2020 put out a global risk report. And you can see from this slide, they outline what were the top risk in terms of likelihood as well as impact. And in terms of likelihood, extreme weather is number one. You'll also see climate action failure there as number two. And I'm going to just kind of loop back to that in just a second. But if we shift over and look at the impacts, extreme weather stays in that top five. Again, hurricanes, tornadoes, and so forth are key to that category. And then climate action failure being number one. Remember that climate and weather are highly correlated in that as we see climate continuing to change, we will see impacts on the weather that we observe in different parts of the world, including in the Caribbean. On the next slide, as we advance forward, why is this so important? And we're going to get at that in some of the discussion today, in that in terms of high impact weather or extreme weather, it disproportionately impacts vulnerable populations. Those young children around the world, the elderly, the disabled, and people in poverty. And one of the key things about this particular slide, when we think about poverty itself, poverty cuts across all of these dimensions. You know, we can think about the elderly in poverty or children that are suffering from poverty. And the real question today is, how do we address that particular issue of hurricanes and our most vulnerable population? How do we set them up to be successful, protect themselves, protect their property, but also be resilient? How do they recover after these extreme weather events? So if we go to the next slide, we'll see just a quick summary of the 2020 Atlantic Basin outlook. And in the lower right of this slide, you'll see the Saffir-Simpson scale, which many of us are familiar with, where we categorize hurricanes from category 1 all the way through category 5. And then we also have those supplemental classifications as tropical depressions and tropical storms. This is important because when we look at the 30-year average, we see that a typical year in our Atlantic Basin is 13 named storms. A storm gets a name when it hits that tropical storm level of roughly 39 miles per hour of sustained wind or greater. And then on average, we see 7 hurricanes each year. And out of that 7, 3 of those are typically major hurricanes. And when we talk about major hurricanes, we're talking about that category 3 or above. Last year in 2019, we saw 18 named storms. 6 of those were hurricanes and 3 of those were major hurricanes. This year's outlook that we are projecting is similar in terms of named storms, with the named storms being 18, but we're also projecting a higher number of hurricanes, 9 of them, and then 4 of those being major hurricanes at that category 3 or above. So we're projecting an above normal season. And we've already seen, even though this is the start of the season, we've already seen a couple of storms already. And if you happen to be paying attention, there is a low over the Yucatan Peninsula right now that's expected to move into favorable conditions for potential development. But the last thing I'm going to leave you with is, you know, while these outlooks are exactly that, outlooks, it only takes a single hurricane hitting a location, and it doesn't even necessarily have to be a category 5 or a category 4. You can get a category 1, category 2, or even a tropical cyclone that dumps huge amounts of rain that can impact our most vulnerable population. So we really need to kind of think about this in a comprehensive way. Don't get too focused on, you know, those major hurricanes, because some of those lesser storms will still have an impact. So with that, I will stop and you know, I'll open up for questions, or we can move into the rest of the program. Thank you.
Thanks so much, Dr. Petty, for that overview. I think it's so important to start with sort of an evidence base here and frame things out so that we're all on the same page here. And I think this really underscores the urgency of this conversation. One question for you in follow-up. I think a lot of people on this call are really concerned with preparing their communities. From your perspective, in the forecasting operations, what do you think is the most sort of important thing for people to be considering at this moment in terms of preparedness, given this forecast?
Yeah, it's a great question. First and foremost, on a yearly basis, we encourage people to prepare by having that hurricane kit available to them, so that they can, if a hurricane does come along, they have things like battery, they have fresh water, they have their medicine, those things that are so critical to carrying you through a few days at least. But then this year is also unique from the standpoint of COVID-19, and we can see that the CDC has already put out some information about having the proper, things like masks, carrying some additional things, thinking about, hey, if you have to evacuate, where are you going to go and how do you social distance? So coming up with those strategies now is extremely important. You don't want to be developing those strategies in the middle of a storm. So we need to really focus on our vulnerable populations, make sure that they are well planned out and prepared so that they can be resilient in this situation.
Great. Thanks so much for answering that question. And
sure.
For all those asking other questions, we will have more time to ask questions of Dr. Petty later in the program. So thank you so much, Dr.
Sure.
Petty.
You're welcome.
Great. And now I'd love to move on to Steve Smith, who is the Chief Executive Officer of Airlink, a long-term CGI partner who we've recently partnered with to survey humanitarian organizations on the impact that COVID has had on their operations and preparedness plans. So it's really my pleasure here to have Steve here today to talk through some of those findings and what they tell us about the upcoming season. Welcome, Steve.
Great, thanks so much, Becca. I really appreciate our inclusion here. So for anybody unfamiliar with Airlink, we're a rapid response disaster relief nonprofit. Specifically, we support a network of 130 disaster relief nonprofit organizations by providing airlift, which comes in the form of seats for volunteers and cargo space for vital supplies of aid, both on commercial and freighter aircraft. And so we respond to both natural and man-made disasters. And we can only do this by, fundraising and support from institutions and foundations, and having deep partnerships with airlines and businesses across aviation and aerospace. So what this means during a crisis is we can get people and supplies across the globe far quicker and easier than the nonprofits might otherwise manage themselves. And the idea here is that we're reducing and removing transportation costs to help them concentrate on getting aid quickly to those on the ground. And so this is all important background in terms of what I'm speaking about today. Given the unprecedented effects of COVID-19 on the normal functioning of the economy and organizations, early into the crisis, Airlink and the Clinton Global Initiative partnered to survey humanitarian and disaster relief nonprofits within our stakeholder networks. The survey was comprehensive, comprising of 26 detailed questions. Over 60 nonprofits responded, and the sample reflected a mix of organizations in terms of scale, geographic reach, resource level, and longevity. By harvesting these insights, we sought to assess the relative health of the sector and clarify the following. Number one, the immediate impact of COVID-19 on humanitarian and disaster relief operations currently ongoing. Number two, the probable capacity of the sector to respond to further natural disasters, which we know are coming. Three, where the breaking points in the nonprofit sector may lay. And number four, whether specific actions taken in advance can mitigate the problems the humanitarian and disaster response nonprofit sector are likely to suffer from, to ensure that they're able to respond to new events. So with these elements in mind, the results reveal a sector deeply impacted by COVID-19, as you would expect, especially in terms of financial resources that can be mobilized to support responses to both man-made disasters over the next 3 to 9 months. I should say that these are some selected highlights, not an exhaustive list of answers to our 26 questions. And I know that CGI will be sending everybody a copy of the survey highlights after the call in the follow-up materials. Respondents were asked to consider likely potential future events, for example, hurricanes, cyclones, and floods, and then answered the questions with that backdrop in mind. The first question we asked, what if a major incident, for example, a flood, a hurricane, or a cyclone occurs in the next 3 to 6 months? Would your organization be able to respond as in previous years? 10% of the respondents said they couldn't respond at all this time, and a further quarter of the respondents said that any response would be substantially reduced in terms of duration, number of volunteers deployed, and resources that could be deployed. So combining these two numbers equals quite a worrying loss of capacity across the sector. And the remaining responses, 43% of respondents would deploy, but at a reduced level. And so shockingly, only 21%, just over a fifth of the respondents said that they could respond as in previous years. So we start to find out just how COVID-19 has affected organizations. And of course, an organization could be suffering from multiple effects all at the same time. Here are some of the key highlights we found. 81% of responding organizations had been forced to cancel fundraising and/or future engagement events. 75% of responding organizations reported that they had been forced to significantly alter their deployment plans. Again, 75% of responding organizations have been forced to change their funding goals. 52% of responding organizations had experienced a reduction in volunteer numbers. 45% of responding organizations had been forced to close programs. And 45% of responding organizations had redeployed volunteers to other projects. So in an effort to gauge not only the impact, but the sentiment behind the impact, we also asked the question, how has the outbreak of COVID-19 impacted current humanitarian and disaster response operations? Now, 45% and 33% respectively either strongly agreed or agreed with the statement that it's had a significant impact on operations. So what does this tell us? It indicates a sector deeply impacted and in a state of extreme flux and uncertainty. And now we shouldn't underestimate the seriousness of having to cancel fundraising events that represent a significant constriction of the pipeline of resources, arguably as significant as the hardest hit business sectors of the economy that we are continually hearing about in the mainstream media. And of course, that is one aspect of this particular pandemic, which is interesting. We've become very familiar with the devastating effects of COVID-19 on business, whether it's the aviation sector, the restaurant and entertainment sector, the healthcare sector, but one facing equal uncertainty and flux, which has received virtually no noticeable mainstream coverage, is our sector, nonprofits, and the humanitarian and disaster relief sector. So exploring this aspect still further, we ask the question, has or will your organization need to adjust service delivery targets for the fiscal year? For example, the number of people you expect to reach, the number of aid shipments you will send, and the number of volunteers you'll deploy. Now, nearly 4/5, 78% of respondents replied yes to that question. And then next we asked, have you had to add new programs to respond to COVID-19? And nearly 2/3 of organizations responded yes to that question. Almost all respondents saw the economic factors as a significant bar to deployment at the same levels as they have been in previous disaster settings in previous years. So what does this mean? At a time of great financial strain and turbulence, at a point when the sector has fewer volunteers than before, nonprofits are having to create new programs and procedures to tackle COVID-19 as we enter a period of additional instability, namely the hurricane season, which starts today. With respect to the Caribbean Atlantic hurricane season, a few main points, which my colleague has just covered. 2 named storms already have occurred in the hurricane season, and it hasn't officially started yet, or it officially starts today. NOAA predicts an above average hurricane season. And as we've just referenced, even a Category 1 storm can have significant impact, lives lost, and also billions of dollars of damage. And many islands that were we're still rebuilding or strengthening infrastructure following storms in 2019 and back in 2017. And those projects have been halted because of COVID-19, which continues to strain healthcare systems throughout the region. So the picture is a deeply concerning one, I would say. One respondent in the free response section of the survey noted that funding in particular would be a significant issue. And if we're looking at it for a broader policy fix, I think there may be something here, whether it's convincing philanthropic institutions or donors to institute some kind of moratorium on restricted donations in order to help support the nonprofit sector in the midst of this economic flux. I think that's really important to highlight, and I know a number of things have been happening. We also asked respondents to the survey to give a simple yes/no answer to the question, do you feel there's been enough coordination in the sector? There's a fairly decent split, with 44% saying yes and 55% saying no. And so while there's clearly some collaboration happening, which is great to see, I think there's still room for improvement, and we could do a lot more and have the sector a lot more prepared for this hurricane season if we can do more. From an Airlink perspective, this was something we perceived early on, and Airlink's mantra is collaboration and working together. And so in part, we saw this during the Ebola crisis in 2014 and 15, even though that's quite far away from here. Our response so far has been twofold. First, we created Aviation Cares, in which I'm proud to say CGI is a partner, which aims to create a dependable, affordable pipeline of cargo airlift and passenger airlift for responding NGOs. And to drive this, we announced a $10 million US dollar appeal, which we're actively attempting to raise money for now in a very challenging environment, as the survey has made clear. And made doubly difficult for us is that our chief benefactors that have traditionally been the aviation sector, you can see the impact that it's had on them as well as others. But if we can raise this sum, we can remove a significant cost burden from the shoulders of NGOs at this time, because the survey, as the survey says, we are all struggling with financial resources and will likely not be able to respond to hurricanes this season with the same level of response as we did in previous years. We also established this appeal and airlift program to help drive organization of and collaboration within the sector. Somewhat a build it and they will come mentality, but the CARES part of Aviation Cares stands for Coordinated Air Response for Emergency Supplies. And so during the Ebola crisis in 2014 and 15, we created an air bridge to West Africa, which enabled us to facilitate the movement of £1.3 million of medical supplies on behalf of 48 NGOs. Our partnership with and the convening power of CGI was critical in this endeavor, as were and as are our partnerships with foundations, nonprofits, and the aviation sector across all continents, including the Caribbean. So being somewhat of the connective tissue between each of these different muscles is what makes Airlink a force multiplier and serves as a critical practical example of how cross-sector partnerships that need to happen in a response to hurricane season in this COVID-19 environment. So hopefully that was helpful. Thank you so much, Becca. Back to you.
Thanks so much, Steve. That was great. And I think, again, really important to kind of take stock of where we are as a sector that is engaged in disaster response as this hurricane season is starting in these pretty extraordinary circumstances that we find ourselves in. So thank you so much for that. And again, reminder for everyone who's participating, if you have questions for Steve, please pop them in the Q&A box at the bottom of the screen and we'll address those later in the call. So now I have the pleasure of calling up a really fantastic panel that we have today. The moderator for our panel today will be Nikema Royer, Chief Executive Officer of Digicel Dominica, and she'll be joined by several fantastic panelists to talk through how they're seeing these specific issues and preparing for this hurricane season. So with Nikema, I'd love to bring up Dr. Joy St. John, the Executive Director of the Caribbean Public Health Agency, or CARPHA, Elizabeth Riley, Acting Executive Director of the Caribbean Disaster Emergency Management Agency, or CDEMA, Ki Lu, Chief Operating Officer of International Medical Corps, and Mariana Reyes, Executive Director of La Goico in San Juan.
Thanks so much, Becca, and good afternoon to all and to the lovely panelists that we have with us this afternoon. So just going back a little bit before we get into our discussion and dialogue, you know, Dr. Petty definitely highlighted what the Prime Minister of Dominica said a number of years ago following Hurricane Maria. The Caribbean continues to be on the front line of the war against climate change, and we continue to be impacted year after year. And then following on what Steve said, you know, the deck is completely stacked against us this year when you look at the impacts of COVID and what we're going to do. But interestingly enough, there's a couple of things that came out here, which is one, the ability for external support is limited. However, the ability for collaboration is also great and the opportunities that lie there. So I think that's going to be a strong part of the discussion that we have. So to kick off the discussion, we'll start off by asking a really simple question, which is, who are you and why are you with us today? And if we can start with Kilu.
Hi, I'm Kilu. I'm the Chief Operating Officer for the International Medical Corps. We are a frontline medical humanitarian organization operating in 30 country missions, and rapid response and providing healthcare in the initial emergency phase is really our specialty. So I'm happy to be a part of this panel. Thank you.
Thank you very much, Key. Dr. Joy St. John.
My name is Joy St. John. I'm the Executive Director of the Caribbean Public Health Agency. And I am here to tell you that even though it appears as if things are stacked against us, in the CARICOM region, that part of the Caribbean that my organization represents and operates in, we don't feel as if we're at a disadvantage. And I will tell you some more about why I think what has happened with COVID-19 has actually helped us to prepare.
Thank you very much, Dr. St. John. Miss Elizabeth Riley from SEDEMA.
Hi, good afternoon, everyone. Elizabeth Riley, I am the Executive Director acting at the Caribbean Disaster Emergency Management Agency. We have a remit under our arrangements to support 18 participating states in the region in all things disaster management, including coordination of response. So this conversation is really very pertinent for us, and we're happy to be here.
Thank you very much. And Mariana Reyes. You're on mute, Mariana.
Sorry. I'm Mariana Reyes. I'm the Executive Director of La Goico. It's a community and cultural organization in Santurce, Puerto Rico. And I'm here to also share our experiences with Maria and our preparedness for this hurricane season that starts today.
Thank you very much. Yes, and the hurricane season starts today. So it's definitely a hallmark day and absolutely the best time for us to be having this conversation with such a broad panel. So one of the first questions that I'd like to ask and I'd like to pose to all of you to get your feedback would be the COVID-19 pandemic has introduced new challenges and uncertainties to hurricane seasons this year. What steps has your organization taken to prepare yourselves for the upcoming hurricane season, and how has the COVID-19 altered these considerations? And we'd like to start with Dr. St. John, who believes that we're actually poised to use this as an opportunity rather than an adversity.
So in the Caribbean Public Health Agency, our hurricane preparedness planning team actually started working in April. With the planning, with the background of our knowledge and experience in such times. And we've actually been not only training our staff, but also we've been gathering together the kinds of things that we need to put in our grab bags. And one of the reasons why I said I don't think it's tapped against us is that the Caribbean, even down to the common man, has got itself into a disaster preparedness mode, which is unusual. What usually happens is that the hurricane season, although we go through it every year, kind of sneaks up on people, and they just respond by buying a lot of food when we get an advisory or a warning. But this time, people started working together, and they started understanding that it's important to prepare, and it's important to know your environment. And from that perspective, Ms. Riley and I have been working since January on getting the Caribbean ready for what we saw as the threat of COVID-19. Normally, I would work with SEDEMA, first at the country level, because I used to be a chief medical officer, but now at the regional level. And our systems of communication and our understanding of how our organizations work, although we're old hands at this, I think these are positive things that have happened. We've understood each other better, and we've understood how to work better together. And so it is with the general public. No, it's all, not all honey and milk in the land of the Caribbean. Some of the issues which were reflected, difficulties with funding, et cetera, and also just the general fatigue of the response agencies, not only at the regional level, like the CARFAs and the SEDEMAs, but also at the national level. There is a fatigue, but the infrastructure for planning together and the infrastructure for effective mobilization of your community, so that the community is prepared to support itself as well, is there. And the other thing is that the general population has even started to understand that if they have to go to a shelter, that they need to be aware of PPE and social distancing.
Thank you very much, Dr. St. Jean. And Ms. Riley, as you were referencing SEDEMA's reference, I think it's only fitting that you jump in here as well.
Yeah, thanks so much. So under normal circumstances, we have an arrangement in the region for coordination of our arrangements for response to hurricanes called the Regional Response Mechanism. So as Joy indicated, the regional arrangements were already in place. In fact, we've had this mechanism for only over 20 years, and it's tried and tested. What COVID-19 has done is really to reiterate and allow us to refocus on those principles of regional solidarity, regional cooperation, and also self-reliance. And I listened to the intervention by Steve, I think it was, from Airlink, very interesting presentation, thank you, about the reality that a lot of the not-for-profits who support the humanitarian sector are this year not going to be available. And certainly one of the considerations that we have been looking at is along this lines, not just with respect to not-for-profits, but also with respect to partner nations who usually support the SEDEMA system. And we appreciate that COVID-19 has impacted everyone globally. And as such, there is the potential for the scaling back of that type of support, whether it is through our not-for-profits or through our partner nations as well. So in that regard, we have been focusing quite a bit, as Joy indicated, since January on really ramping up the regional level planning. We have a lot of arrangements for providing surge support to our sister states. And even though we couldn't undertake the traditional face-to-face training, which we normally do every year, what we have done is to fall back on contingency arrangements where we have teams who were trained in previous years and we have called them back up. And we're doing refreshers then through online mechanisms, etc. So the human resources for the surge support, they're available. What we are looking at, of course, is the fact that we're going to have some adjustments to how that surge support can be delivered. And we're making arrangements guided, of course, by CARFA and the health officials to make sure that we're proceeding with a principle really of do no harm. We want to keep our responders safe, and we also want to keep the populations who are the beneficiaries of this support safe as well.
Thank you very much, Ms. Riley. And Key, how has the International Medical Corps been readjusting its position in light of COVID in advance of the hurricane season?
Thanks. Maybe perhaps before I answer that question, I think my fellow panelists will agree that the most effective thing that we can do to save lives and alleviate suffering, whether it's a hurricane or an earthquake here, is to build and strengthen local disaster preparedness and local disaster management capacity. And when that disaster overwhelms local capacity, and that's really where the International Medical Corps can intervene and support local actors to be able to carry out life-saving activities. So if you look at our recent response to Hurricane Dorian, right, last year, we were able to deploy a team of 23 members of doctors and nurses and logisticians and technical experts ranging from water and sanitation to mental health to be able to provide critical care in the immediate aftermath. And we were able to scale up operations within 72 hours of the hurricane making landfall. But when we arrived in the Grand Bahama, we closely coordinated with the Ministry of Health and the local authorities to start developing a plan to transition our direct service provision so that we can promote early recovery. And working with the local authorities, right, we then shifted from direct provision of services into providing financial incentives for local healthcare workers to return back to work, engaged in training, capacity building, and providing assets like mobile medical units for the local authorities, not only for the current response, but also to build capacity for future responses. So I think those activities, in terms of the principle of supporting local actors does not change with regard to how we will be preparing and responding to a hurricane. That said, obviously responding in the midst of a pandemic does change things a little bit in terms of how we protect our own staff and our beneficiaries. It was talked about here in terms of the need for sufficient PPE, supply chain, but also now working very closely with the local authorities to ensure the vital public health systems around surveillance, disease tracking, laboratory testing and detection are up and running. We also have to ensure that case management for existing COVID patients is there. And I think the most important thing that we can do as an international response agency is to start that dialogue with local actors in advance of the hurricane season. We've been doing that, better understanding who the local actors are, understanding where the gaps might be, but also understanding what that messaging that is taking place around what communities and people need to expect in preparation and responding to a disaster. So what has the guidance been around sheltering, right? And making sure that there's social distancing, making sure that there are barriers to safeguard and mitigate against face-to-face interactions, and really being part of that strategy in terms of communicating to ensure that there's trust, so that when people are looking at early warning, when they're asked perhaps to evacuate, when they're asked to go to shelters, that they understand what and how they will be cared for. And I think that's critical. So for us, it's really around now paying careful attention to the provision of PPE for our staff, for our beneficiaries, as well as local actors, and then taking part in that communication strategy. So it's active, it's accurate, and it's truthful in terms of how we will respond and how we will be able to do this in the midst of the pandemic.
Thank you very much, Key. And you touched on something I'd like to circle back on, which is around the shelters and the evacuation and how to maintain the social distancing and the COVID preventive measures under such situations and cramped locations. So we're going to come back to you in just one second. But Mariana, please tell us what's going on with you in Puerto Rico.
So Lagoico, our organization, is a very small community organization that works entirely with volunteers from our own community. So we don't provide services such as first responders as such, but we do provide services that come with whatever situation we're going through. Like, for example, with the COVID, we've had to change our programming to do rapid tests. And mostly what we've learned from this experience entering the hurricane season is that we've connected with people around other needs that are also common after a hurricane, like, for example, food banks and other grassroots organizations that work with providing food for the population, because we work here with an elderly population mostly, and many of them live under the poverty level. So this is one of the challenges that COVID is presenting us, more than the health challenge itself, the ramifications of the consequences of the entire process that has taken people from a very fragile middle class to poverty almost. And this presents us with a new set of challenges of how to deal with the basic needs of our neighbors. So we've managed to reach out to these other organizations during the COVID emergency, and that makes us stronger entering the hurricane season also.
Thank you very much for that, Mariana. And that's definitely something. A couple of weeks back, I was on another conference call with CARICHAM, the Caribbean Chamber of Commerce, and the UN presented a report that reminded us that a natural disaster such as a hurricane or even the pandemic we're going through usually spawn so many other impacts that maybe are not thought of or quantified for, such as socioeconomic or mental illness and so forth. And I'm jumping right back to Dr. St. Jean on this one. How do you, with all of that in mind, how do you balance immediate concerns of responding to the public health crisis of COVID-19 with your typical plans to prepare for the hurricane season? Are there other health challenges your agency anticipates will come with the hurricane season, such as mental health concerns or non-communicable diseases?
Well, we were looking at non-communicable diseases from the start, because early on, it was identified as one of the risk factors for developing the more severe forms of COVID-19. So our team at CARFA has been working very hard. And in parallel with all of the work that we've been doing with COVID-19, there's been a lot of preparation behind the scenes for linkages with the ministries of health. We have also launched a Caribbean Moves project. We've started our steering committee meetings, and we will have a formal launch. So this whole idea of healthiness in the midst of COVID-19 is very strong. And in fact, this Friday, the chief medical officers are going to have a meeting. We start a series of meetings with them where we will talk about some of these elements as well. But it is not just NCDs, and you're quite right in focusing on the mental health aspect. And mental health aspects span the age ranges, because COVID has changed how we do everything culturally. And if you see the responses of different regions of the world, you will see the different personalities. And our personalities are warm. We do a lot of interacting. We do a lot of hugging. And so across the age groups, the age range, people have been suffering. And then there is the whole issue of the lockdown. And when people weren't able to be active, what this did. And there are initiatives now being led by PAHO, where we're coming together to see what are the value adds that we can bring to the mental health discussion for the first responders, for the sectors across the age ranges. What are the modalities as well that will reach people now that we're relying so much on virtual interactions? But there's another thing that we've been preparing for. And this usually comes up with the rainy season, and that is vector-borne diseases. And CARFA has EU funding, as it does for COVID-19. We have EU funding for vector control. So our vector control team has also been working on preparing for the possibility of upticks in vector-borne disease. And as you know, with CARFA, we are not just an epidemiology institute. We are a public health institute that is the merger of 5 former regional health institutions. And we had embarked on an integrated surveillance strategy. So we're bringing together the strengths of many teams to see how we can improve on the preparation and response for 4 major things: COVID-19, NCDs in COVID times, not only in and of itself, but also as a risk factor for the severe aspects of COVID-19, the mental health concerns, and vector-borne diseases. So there is a lot of integration of the work of our teams. We have an incident management team that overall has been managing COVID, and we've got subgroups working on each of these and integrating it into how we support the member states.
Thank you very much, Dr. Sanjan. And in addition to being the CEO of Digicel Dominique, I'm also the chairman of our business continuity management team across the Digicel group. And this year we're focusing on 4 potential threats: hurricanes, COVID-19, of course, earthquakes, as well as burnout in terms of the mental health and the well-being of our teams.
I need to talk to you then.
Because it is so important, especially as COVID-19 is not your typical crises. A hurricane, for example, has a start and end point. So you go through preparation, you're impacted, you respond, you recover, and you move on. COVID-19, we don't know when that's going to end. So the mental health of our teams and their well-being and their spirituality and everything else that goes along with it is so important, because without them, we're not going to be able to respond. We're not going to be able to recover. And then as I'm talking about our BCM team, one of the things that has come up time and time again as we go through our preparation in advance of the hurricane season is the shelters key. Because some of our real estate is utilized as shelters for our teams, our core teams, and trying to understand how can shelters and evacuation services adapt their plans in order to safely provide for as many people as possible is of keen interest for businesses that utilize their places, but also shelters within countries that are already limited and at times in a hurricane or in an emergency are oversubscribed already, much less when you overlay the COVID. So Key, we'd really be keen to hear some guidance on this one, because I don't know where to go with it.
I'm not sure that I had guidance, right? I mean, I think that we all recognize that with COVID-19, that we've already seen this where it will impact on the willingness of the general population to perhaps shelter within these structures. And I think that comes down to the point around the need for information campaigns, social media, local radio, to be able to explain the conditions within the shelters, explain the types of public health behaviors that will be expected of individuals as they go into the shelters, and manage those expectations and gain their trust, right? So I think one of the things that over the years, clearly within the Caribbean and communities within the Caribbean, is that they're very well prepared. That early warning systems, surveillance, right, evacuation routes, they're robust. And obviously large-scale hurricanes and disasters, they can be overwhelmed, but relatively quickly, logistically speaking, we can clear the roads, we can get teams to access the population. The challenge here will be that I think we can expect a larger population that will remain in place, that will be unwilling to go into shelters, which means that we will have to invest in more mobile medical teams, more search and rescue teams. It will be costly. You know, and the only way to be able to mitigate against that, again, would be to have a robust communication strategies here to build that trust. And that starts, again, that with local communities, local officials that know best how to be able to draft and create and disseminate those information campaigns. And for organizations like the International Medical Corps, it's our duty to understand what that communication is so that when we deploy, right, we're able to support local actors. So unfortunately, the space issues will be there. We'll have to social distance, I think more pre-positioning of PPE in secure places, and communicating again, right, constantly and being truthful about what the general population can expect and how we can respond to a disaster and how we can do that to balance how we're also responding to COVID-19, I think is critical.
Thanks much, Key. And you've definitely just segued straight with Elizabeth at SEDIMA, who partners with the governments and the local actors. So Elizabeth, in terms of SEDIMA, who works in partnerships with the governments, and I've worked with SEDIMA after Hurricane Maria, and I've seen the great work that you've done throughout the region, what are the key needs you've observed as your member states prepare for the hurricane season? And importantly, in what areas would external partnership be most helpful?
Yeah, thanks so much for the question. I think one of the critical areas that we've seen is the need for strengthened guidance tools for our countries, and SEDIMA has been investing quite a bit of time on that, including in the area of shelter management and taking into consideration the protocols that are now required for the shelters. Another critical area that we're looking at is that of emergency communications. And I think we've gone through, well, you work with Digicel, but we've certainly gone through these experiences in the Caribbean. It's well known to us that the emergency communications is one of those areas that fails. And we recognize very much that in this particular scenario, in previous years, we might be able to send in very quickly a surge team who can help quickly to bring back up communications, etc. So what we're discussing now is really looking at opportunities for how we can do better pre-positioning of equipment, which will support the states in their capacity to be able to bring communications back up more quickly. And why it's very important for our operational plans is that we're also looking at how we might be able to deliver surge support remotely, since we know there's going to be a lag time as a result of the health protocols, which we're very committed to observing. I think also the third area I want to mention is actually with respect to logistics, because certainly the Caribbean is complex logistically in the aftermath of events, and from the SEDIMA side, we coordinate quite a bit on the area of logistics. We're working right now, for example, in setting up a hub which will not only facilitate the distribution of critical medical devices and supplies in support of COVID-19, but it's also going to support requirements during the hurricane season. And that's going to be based in Barbados. And this is an area where I think there's a space definitely for partnerships as well.
Thank you very much, Ms. Riley. And you can definitely count Digicel in. Expect a phone call from me tomorrow to get, an eye on those protocols, as well as Dr. Saint-Jean at CARFA. Collaboration is key, and Digicel has always been really keen on that cross collaboration because we understand what it could bring for the countries within which we operate if there's a threat. And with that, I'm going to jump right across to Mariana. So the COVID-19 pandemic is just the latest of many challenges that Puerto Rico, as well as the rest of the Caribbean, has faced in several years, including economic crises, Hurricane Maria, earthquakes. So as this hurricane season approaches, what are your key concerns and priorities for preparedness?
Well, we learned a lot from Maria, and we know that the main things that affect our community in specific, which is a coastal community in San Juan, is flooding and lack of power, electrical power, for a long time, and also the access to food. So those are the main things that concern us as a community, to be able to provide for our neighbors. And our key to be able to do that is mostly organizing beforehand, being able to have a plan, a well-scripted plan before the emergency hits, And we've been doing that ever since 2018, right? Trying to get ready for it. And we've been able to have a very small resilience hub with solar panels at the abandoned school from which we operate here in the community. And that the dining room of that old school is completely solar. So we're able to have food, make food together, and be able to have people to connect their cell phones and have power within that place. And it was, we tried it when the earthquakes came in January. We were without power here in this area for like 7 or 8 days. So we were able to have a rehearsal, and luckily we won't be able to have a long version of that, but it worked very well. So we're still focusing on getting together other collaborations to be able to be better equipped before whatever emergency hits.
Thank you so very much, Mariana. And I know I could continue having this conversation all day and for days to come. However, we have come to the end of our panel. I am going to ask each one of you to give closing remarks. And if I can also ask you just to keep in mind as you're giving those remarks, what are the most important first steps participants on this call can take to best prepare themselves, their organizations, and their communities for the hurricane season and in light of the COVID-19? And Mariana, I'd love to start with you, please.
Well, I think that one of the main things that we need to focus on, at least in our case, and I'm pretty sure it's similar in other islands in the region, is to be able to establish strong links with other organizations, be very equipped to be able to handle the emergency when it comes, and be certain that we have each other's back in a grassroots organization like the one that we have. That is what actually saved us last time around. And especially with that topic that other panelists were mentioning before of the mental health crisis, that all these emergencies, one after the other, it takes a toll on the community, on the people that is working with them, and basically on everyone, because there is a lot of uncertainty. You never know what is going to hit next, but you know there's something coming. So, so basically we're looking forward to have our preparedness ready. We actually have a meeting next week to have our community plan, and hopefully we'll be spared the entire region this year.
Thank you very much, Mariana. Key, your final thought?
Sure. So I've touched on local capacity building, ensuring that there is clear and honest communication to the affected population. But for the International Medical Corps, and I think that for international actors, access to the affected population in the first 72 hours is critical in terms of being effective in saving lives and alleviating suffering. So working closely with local authorities, for example, if we're to deploy our teams, do our teams have to have a 14-day quarantine period in advance of deployment? Can we figure out these logistical questions so that we can get our team members, our supplies into the affected areas? So again, I think it comes down to today's June 1st. This is the start of the hurricane season. We need to work out some of these details so that when the hurricane does make landfall, that local actors have the capacity, and if their capacity is overwhelmed, international actors have the ability to rapidly and effectively get on the ground and scale up operations.
Thank you very much, Key. And I think I'm jumping back across to Ms. Riley in terms of that local actor collaboration.
Yeah, absolutely. I fully agree with Keen on this point. I think the individual preparedness is very critical, especially for those individuals who are working in supporting emergency services. I think it's very important that we can rest on those assumptions that the people that we need are available at the time that we need them, and individual preparedness at that level is also very important. Community preparedness, as well as institutional preparedness. And finally, that as we go through looking at preparedness actions at the community level, that we have to actively look at economic opportunities, even in the preparedness actions for persons at the community level. We have a situation where many persons in the Caribbean have been significantly impacted, their livelihoods disrupted, income flows, in some cases, obliterated. And we need to ensure that as we're going through preparedness actions, what are those opportunities that we can give them to be able to earn some measure of income so that they themselves can be prepared as well. Thank you.
Thank you very much, Ms. Riley. And Dr. St. Jean, your final thoughts, please.
Planning, coordination, and communication. And let me focus a little bit on the coordination when it comes to the CARICOM space. And here the heads of government have given certain mandates to CARICOM institutions like CARFA, like CDEMA, for common public health policies and protocols. And the coordination is also about getting supplies, getting reagents, getting equipment, coming up with what are the measures that allow persons to move safely in the space, first in the intra-regional space. And so it's going to be very important that the understanding of how the CARICOM region and the member states are coordinating is critical. In this regard, CARFA coordinates from the health perspective. CDEMA has a coordinating role for the other sectors. And I think it's going to be critical as we go forward that the coordination and the communication make sure that blended messages and consistency in the blended messages goes out around the region and outside so people know precisely where we're coming from. I think opportunities such as this, the panel that we are operating in right now, are critical. And I want to thank the organizers for giving us the opportunity to learn from each other and to get our message across. I also want to say that I would really like people to focus on these frontline first responder organizations, such as the ones that I've met today or reacquainted myself with, because the role that we're playing in the governance of how we get through COVID-19 cannot be underestimated. And from that perspective, I want all of us to stay safe.
Thank you very much, Dr. St. John. And I'd like to say a really huge thank you to Marian Key, Dr. Joy St. John, as well as Elizabeth Riley from CDEMA. Each one of you play an absolutely pivotal role in ensuring the Caribbean is prepared for any threat, positioned to respond to any threat, and importantly, to recover from any potential threats that the hurricane season has. And thank you again to the Clinton Global Initiative for having us today. Becca, back to you.
Thank you so much, Nikema, and to all of our fantastic panelists today. It was really, really helpful to hear from all of you and your perspectives here, how you're addressing all of these things that are on so many people's minds. And thank you for underscoring the importance of economic opportunity and communication, mental health needs, and so many more things that I think we all should be keeping in mind. So thank you again for your contributions today. And as a reminder to everyone else, if any questions come up that you have not yet entered into the Q&A, please do that now, and we will address any remaining questions in the Q&A section at the end of the call. So now I'd love to go to our final speaker of the day, and last but certainly not least, we are really pleased to be joined by Tahseen Sayed, who is the Country Director for Caribbean Countries for the World Bank Group, who will share with us some closing remarks today before we move to Q&A.
Accept this. Okay, you can hear me now, right? Yeah. Okay. Good afternoon to all the panel members and all the listeners and friends at the Clinton Initiative. I do want to start with it was very heartening to hear my colleague from CARFA, Dr. St. John, gave a positive start when she spoke. And I want to really emulate you on that by saying that, yes, there are all these global concerns with COVID-19 and the fact that each and every country is impacted, which could impact the response if, God forbid, there is an extreme weather event this season. But I want to say, at least on behalf of the World Bank, that the World Bank will be standing with the Caribbean, no matter when the lights are on or off, no matter when the cameras are gone, we are there. And this is a very strong commitment I want to make right here in this forum to all the stakeholders who are present, because it is the accountability and the responsibility of the World Bank to be present with its shareholders, no matter large or small. With that, let me say that a lot has been said, and I was really listening very carefully to the points being raised at the start by Dr. Kevin on the severity of this potentially this season and the extreme impact that could come in. Of course, we all know that globally about 26 million people annually are thrown into poverty because of extreme weather events. And today, as we speak, that number could be much larger because of COVID-19. The estimates are still going on because the crisis is not over. The fact that a very important dimension of bringing support to the countries when there is an event, and that is the air transportation and the air connection. And we know the problems that are there right now with quarantine still there, with lockdown still there. Having said that, I think it is important for all the friends of the Caribbean and the Caribbean people and the stakeholders to recognize, as it was mentioned, that I think it was a colleague from Sedima who mentioned that for the past 2 decades, the region has come a long way in terms of the strength of the regional organizations, underpinned through the support from CARICOM, and also the national governments, to be in a better state of preparedness. Where the issue now comes is that has COVID-19 diverted the attention of the key players at the country level and at the regional level. And we're still trying to, I have to be very frank, we're still trying to assess with our countries and with the regional bodies, our teams who work with CARFA and with Sedima, to assess that issue, that what is the impact of the digression to COVID-related issues. The good news on COVID for the small islands at least is that early lockdown, early measures have contributed in containing the spread. And that's a very good news. And the biggest worry I have today as we sit here, that many of the countries are going to open in June, and the standard operating procedures, or SOPs as they're called now, have to be really very strictly managed for people coming in. As we know that all the cases in the small islands were the travelers coming in. So that's something that the countries have to be very careful on, about to avoid a double jeopardy of a potential extreme weather event and a rise in cases because of travelers coming in when the airports open. Having said that, let me touch upon 2 things. One is, actually 3 things very quickly. One is the preparedness part. And there, the role of communication, the information sharing, and the technical support and capacity support is extremely vital. And I do feel that in the last 3+ years after Maria, I've been interacting a lot with the Clinton Foundation team, CGI team actually, as well as the events that you organize with all the stakeholders. And I think this is where organizations like the Clinton Global Initiative and the partners you have, the network you have, can be extremely important, because never before has there been a more critical role for local organizations to play in such, in the case of such disasters, if they happen, God forbid. Never before has the role been so vital as now of local organizations. And those organizations are local organizations, I mean, in the Caribbean itself, in the countries and at the regional level. And those are ones that the nonprofit sector, the NGO sector, the aid agencies are more connected to than organizations such as mine. Not that we don't want to, but our engagement is predominantly with the public sector and with governments and through those with the smaller organizations. So it'll be important to connect really strongly to those local organizations. That would be my key message in terms of preparedness. Second, in terms of the biggest concern, I mean, if we divide the situation in preparedness, the event itself, and after the event. The event itself is the time that I would think would be more worrisome because of different ways to manage it. The social distancing required for shelters, the fact that there would be need for masks, there'd be need for disinfectants, there'd be need for a lot of water supply. Water will be critical, not just for drinking, but also for washing. So those are practical matters which are required at the country level, and again, local organizations and regional organizations like SEDIMA or CARFA can play a very, very important role. The third aspect is after an event. Now, there I would like to, I think there would be a natural stress amongst, it's not mentioned to me personally or my colleagues, but if I were, say, a prime minister or a finance minister or a leader of a small island state today, my big stress also would be that, God forbid, if I am hit, would there be support for me? Would there be the coordinated support because of the COVID going on? And there I can say that, at least from the World Bank side, yes, we'll be right there remotely, if not possible physically, but you will also have other partners coming in, the nonprofit sector, the aid agencies, and I'm sure bilateral friends. I want to share the example of, you may be aware already, that in April 2020, which is a month plus ago, there was in the Pacific Islands, they call hurricane cyclone. There was a Category 5 cyclone called Harold, which hit 4 islands. And we've been interacting with the teams to find out how they responded to it, how the world responded or the region responded. And they had a good news that they didn't have COVID cases except for one island, Fiji, very few, but the others didn't. However, they were under complete lockdown and quarantine conditions. The teams tell me that there was a 2 or 3 days delay in the relief goods to come in because they had to be vetted at the airport, the quarantine SOPs, etc. So that's one thing to keep in mind. If there's relief coming in, then make sure that the airports, the staff there can work very fast in managing those relief goods coming in from the COVID-19 SOPs point of view. I think those are sort of, they're small details, but they're important because the time, it's all about speed and time. The speed with which the support is given to those in need and the timing of it. So that's why I refer to these points, which may sound small, but they're important for those people who need that help at that time. The second point for experience from the Pacific has been that they had countries like Australia and New Zealand, who are their key partners, where the cases were less and they were able to come in rather fast. In this case, that's a question mark because countries like Canada or US or UK have been very badly hit. I cannot speak for their governments, but there would be, I would think, support available, God forbid if something happens. But technically, the colleagues in the region will be the biggest support. By that I mean colleagues from SEDIMA and CARFA. From the World Bank side, I do want to share that there is a methodology that we have put in place, which is called GRADE. I'm trying to figure out the acronym for GRADE. I think my colleague from SEDIMA would know that. It's to assess the damages, the damage assessment, looking at a particular hazard methodology remotely. So this has been done actually just now for the Pacific countries as well, remotely, because our teams cannot travel. And it looks at previous data, and it also looks at modeling exercise. It doesn't give economic losses, but through aerial views, satellite imaging, drones, etc., it can with quite a bit of accuracy, give the damages and the spatial damage impact. So that information, the needs assessment, can still be done under the current situation. The final point I wanted to mention is that and I'm going to repeat that point again, I mentioned it earlier also, that, and many people have mentioned today, that the whole experience of natural disasters, or in fact any crisis, is the coming together of groups, organizations, individuals, and a coordinated response. Be it international organizations, international financial institutions like mine, the World Bank, aid agencies, local organizations, regional organizations, organizations like the Clinton Foundation. It's really getting together as a group. Hence today's event, I think, big thanks to you, team CGI, for starting on June 1, because it's important for this message to go across that the key partners who can come in to partner with the Caribbean in case there is such a situation that comes. They are thinking about it, not just totally submerged in the COVID-19 crisis, and ready to jump in as the situation emerges going forward. And we hope that the region would be safe, but we can't live on hope alone. We have to be prepared. Hence, this event is very, very important. With that, let me just say finally that the key lesson, one of the lessons of COVID, or one of, not the lessons, what we are seeing in the ongoing COVID crisis is the role of one critical discovery of the 20th century, and that's technology. Technological development has played such a critical role. We couldn't be talking like this if we didn't have that. So that's a key one to and my colleague from Digicel, Dominica, knows that after Maria, there were several days when even the WhatsApp was not working in the island. So that's the key preparation essentially required to make sure that communication can be maintained with technology. Thank you very much. And I'm ready to, if there's any question, anything that a link to the World Bank, I'm very happy to come in for that. Thank you.
Thank you, Tassin, for all of your comments. This is really helpful, and it's great to know World Bank is committed as ever to supporting the region during this hurricane season. And thank you for raising several really key points that we will tackle later on in this call series, and emphasizing the need for coordination as always. So thank you. Now I'd love to take it to our Q&A section. We've had some great questions that have been submitted for our panelists. I'd love to start with one question for Dr. Petty, which is actually what factors are contributing from a scientific point of view or climate point of view to the higher forecast for this year's hurricane season?
Yeah, that's actually an excellent question, something we really didn't have time to get into too much, but I'll try to keep it fairly succinct. When we are making those predictions, we're looking at a number of things. Right now, what we're seeing are sea surface temperatures in the Atlantic Basin are some 5 degrees Fahrenheit higher than normal. We're also looking at things like La Nina in this situation, where we're examining what's going on in the Pacific region, as well as the North Atlantic region as it relates to pressure gradients or pressure differences over parts of the North Atlantic. The reason, and again, I won't go into detail, but the atmosphere and the ocean all are working together. And we know from historical research that there are correlations between what we are seeing now and what the projected hurricane season is going to be. So several different factors that are based on very sound scientific principles are pointing us in that direction of a higher than normal hurricane season.
Great, thank you so much, Dr. Petty, for clarifying that. That's super helpful information. Our next question that we received is for Elizabeth Riley of CDEMA. And the question is, do you feel that there is enough being done to pre-position emergency supplies, so shelter, hygiene and sanitation, health and other life-saving and life-sustaining supplies in key countries in the Caribbean in order to support an early and fast local response?
Thanks so much for the question. So I refer again to our regional response mechanism. One of the arrangements that we have within the RRM, as we call it, is what we call our sub-regional focal points, where we have geographically zoned the 18 CDEMA participating states into 4 areas. And each of those areas has a lead country, as it were. So the 4 focal points are Trinidad, we have Barbados, we have Antigua, and we have Jamaica. And a part of this system is actually a sub-regional warehouse. And the warehouse has an array of immediate relief items that are made available to any of the states. And the reason why we position them there is that if any of the states within those areas requires surge relief supplies, we can access them quickly. Now, to bear in mind about the question of adequacy, I think that's really where the question was going. So the warehouse management is handled at several levels. So each of our states, in fact, has national level warehouses as well, which have emergency stocks to last for a certain amount of the population for a certain period of time. And in fact, several of the states, because of geographical extent, have several national or warehouses. So multi-island states may have smaller warehouses on some of the other islands, etc. And then larger places like Belize, Guyana have other warehouses in different regions. So we have several layers. So the first layer is the national. The second layer is at that sub-regional level. And then we go into our remote arrangements where we tap into partners like our UN, etc., who can draw resources out of Panama, etc. So through these arrangements, we find we are able to address, certainly we have in the past been able to address the immediate needs of the states. And certainly based on the learning that we've had, we have stocked up supplies since 2017 events with Irma and Maria, and also had a relook at this in the aftermath of Dorian in the Bahamas as well. So we learn as we go, but we're doing the best as we can based on the scenarios that we've gone through. Over.
Great, thank you so much for that question, or that answer to that great question. And it definitely sounds like some really robust learnings and preparation have taken place. So thank you for that. There was a great question as well, which I'll pose to all of you, and whoever wants to jump in can go first. Given the issues observed in Airlink's research that Steve presented early on the call, it seems more important now than ever to strengthen and expand local response capacity. Could someone speak to how local initiatives and efforts are being supported through funding, skill building, and other types of resources? I know that's something that you all emphasized strongly on the panel. So curious if anyone has further thoughts on that.
So I could take a stab at it, Liz.
Perfect.
Okay. So this is a matter we've been discussing with our national emergency management coordinators. We have a coordination meeting, in fact, weekly with that group since the COVID event started. And we've also been engaging our development partners on this issue. And so one of the things we have seen is that there has been quite a bit of willingness of the development partners to be flexible in terms of how the financial resources that are currently available under established projects can be modified or repurposed to treat with some of the emerging concerns for the states. And I think this has been a very positive sign. In addition, under the European Development Fund 11, we have already signed off a project with the CDEMA coordinating unit, which has a facility within it that we started negotiating with donors a few years ago called the Country Directed Fund. And this provides small pools of funds for countries to support national level priorities. And we are seeing our countries tapping into that small grant facility to be able to address some of the requisite training needs at the national level. I can't speak to whether what is available is fully adequate in terms of the needs, but what I can point to is that we have seen responsiveness from the development partners to be able to treat with some of those emerging requirements. Over.
That's great, thank you for that. Another question which is directed to Nikema. I think as a telecom company, Digicel obviously covers much of the Caribbean region. So from your perspective, what do you think, sort of building on what our colleagues from CDEMA and CARFA have shared, what else can Caribbean islands do to collaborate and coordinate more to support one another during disasters or in preparedness for disasters?
Thanks very much for the question, Becca. So one of the primary things that I think needs to be done across the Caribbean region is that we need to look at business continuity management and crisis management as a year-long activity of events, rather than starting just in preparation of the hurricane season, right? Business continuity management is about continuously improving upon your business practices or processes and systems to ensure your business can continue through absolutely any threat. And Dr. Joy St. John would have referenced this, that, you know, we're starting to see the culture change within our people, that it's not just, you know, when the storm warnings or the watches are issued that we start getting prepared. However, we still have a lot of work to do with that. So as a telecommunications provider, we try and ensure that we're communicating throughout the year of the importance of being prepared, and even this year. And I believe for the last 6 years, and Dr. Petty, I beg you to correct me if I'm wrong, but there have been named storms ahead of the June 1 start date for the last 6 years. That's no longer a trend. Like, maybe it's time for us to start considering changing the start of the hurricane season so that persons can be prepared in advance. But I really think it's about a culture shift, a mind shift towards preparedness as a state of being continuously, versus just for that June 1 timeframe and counting down to that November 30th date, as if after that, you know, we go back to normal. It's a new normal right now, and we just need to keep moving and keep shifting with the times towards having this as part of our daily, everyday routine. Everything we do is our thoughts are preparation, response, and recovery. You know, not looking at adversity, as that's where we are, Dr. St. John, but definitely looking at the opportunity to ensure that we are a truly resilient people in all aspects, and not just for 6 months out of the year for the hurricane season.
Yeah, absolutely. Thank you for that answer. I think that that really resonates for sure. So thank you for that. The one other question that I'll pose to all of you, and I think you all have a number of really interesting perspectives on this, is a question about preparing for a multi-event emergency. So multiple emergencies sort of on top of one another, and how organizations, sort of large and small, can take on coordinated planning so that there's not oversight of certain issues or contradictions in their plans.
Well, Becca, maybe I can have a comment on that one.
Sure.
And I would commend, thank you CGI for pulling this together, and also the work of CDEMA. I think one of the things that's really important about preparation is also leadership. One of the challenges, always a challenge all over the world, even wherever you're based, is getting a clear signal and steer as to what the key and critical needs are. And I know CDEMA works very hard with all of the member nations to do that. But especially on the back of many years of responding to disasters, you know, in logistics, there's a tremendous amount of duplication of efforts. And so to the extent that that clear demand signal, which is tremendously difficult to get, by the way, but to the extent we can get to the critical needs as soon as possible, that's really very helpful.
That's great. Thanks.
Can I take a stab at that? Do you
Yes.
have time?
Yes, absolutely. Please
So
jump in.
one of the things about public health is that you always have to be ready. And one of the missions of CARFA is this whole issue of training and retraining and repurposing and retooling, re-equipping. And another mission of CARFA is this whole idea of projections and seeing what are some of the risks coming up in the future. And then there is the issue of having common platforms for discussion. And so you have a baseline, and then you build on that so that there is capacity building to be able to respond to several different things. We're talking about hazards in this case. And I think the CARICOM setting and structure also lends to cross linkages. What we have tried to do in CARFA is to come up with a way of planning so that even if we have many different funding agencies that only fund certain countries, that we have a way of making sure that everyone has capacity building and understanding and knowledge in health. And then through the CARICOM mechanism, we can have this spread. And COVID-19, as awful as it has been one of the very good ways we have had of getting public health messages across to many disparate sectors from the perspective of business continuity. So I was really interested when Nikema made that point. So in this whole quest to move forward at a time where it seems as if everything is being obliterated, we're trying to find the key things that ensure our resilience. And the duplication of effort is we're trying to cut that down by ensuring that even if there are multiple donors for a particular heading, for example, capacity building, that each donor funds a section which is unique to them. So they have their piece of the pie. But the overall puzzle is served. So there has been a lot of systematic changes within the way CARFA organizes itself and prepares and supports countries for their response along these lines. But I want to say one thing. One of the ways that we have to look at the new normal is that we have to have more robust telecommunications systems, better bandwidth in the Caribbean, because practically everything, even if we have moments of coming together, practically everything is going to fall back on virtual. So Nikema, I'm calling your name twice. Nikema, we need some robustness in that sector.
Absolutely. Thank you, Dr. St. John. That's great. I would love to give all of our panelists an opportunity to answer this question because I think it's important. Maybe I'll start with Key first. And again, the question was just around advice for preparing for multi-emergency events.
Yeah, from the health sector, right? Just to add to the conversation, I think that people have talked about preparedness and planning and coordination is critical to being able to manage response to different hazards and to be able to pivot and adapt in real time. And an initiative that we strongly support and we've been part of is the emergency medical team, the EMT certification process with the World Health Organization and the Pan American Health Organization, PAHO. And I think that that will go a long way. That ensures, right, that when international medical teams are deploying, that their staff are trained, there are SOPs in place, that then when they deploy, they are hitting the ground with the necessary supplies to be self-sustainable and to scale up within that 72-hour period. But I think hand in hand with that training and ensuring high quality interventions is to be working with local ministries of health so that in that disaster phase, when they're asking and calling for teams to arrive, that they have the assurances that these teams are equipped and capable of responding, but building that local capacity allows us to pivot. So we've seen time and time again, you're responding to an earthquake that triggers a tsunami, and therefore making sure that gaps are addressed and we're able to coordinate and send teams into those regions to the affected population to ensure that there's coverage across the board. So I do believe that, again, preparedness, planning and coordination and initiatives like this EMT certification will go a long way whether we're dealing with a hurricane response, with a pandemic, that just allows us to perhaps be more collectively effective.
That's great. Thank you for that response. Love to just give Elizabeth Riley a chance to respond as well here.
Yeah, thanks so much, Becca. In fact, some may argue that we're already on the brink of that multi-hazard scenario. I mean, we talked today about other hazards that are impacting, but the reality is the Caribbean has been most of the states have been suffering from a drought since early 2019. So even in the midst of having conversations about robust hand hygiene, etc., adequate water supply, etc., in shelters, we're still in many geographical spaces battling with the reality that we have shortages of water. So we have drought, we have COVID-19 ongoing, we're in the midst of the hurricane season, and my colleague from Digicel quite correctly indicated that there's increased seismic activity and volcanic activity, for example, in Dominica, and we have hundreds of earthquakes in the region which happen all year round. So I'm saying that to say that the scenario is already upon us, and we've already faced these types of situations previously. So what is really needed is it's about the coordination. This is how we deal with it. It's about the coordination. And so I keep coming back to the regional response mechanism because this is our coordination mechanism we've had for over 20 years. It is supported by a range of regional, international partners, local partners, and there's a lot of confidence. And this is what is very important in coordination mechanisms. There's a lot of confidence in the coordination mechanism. And because entities have bought into it, they bring their offers into the discussion of the coordination mechanism. We have an arrangement where information needs emerging are brought to the coordination mechanism for wide dissemination to get the kind of matching of needs to what is being offered and the parceling of the pie as indicated by Joy. And to me, a very critical piece of it is actually the exercising. So we don't just wake up tomorrow and decide we're going to coordinate. No, we have to look at various scenarios and work them through in a very honest way. So just last week we had exercise synergy, which is the regional exercise. We had almost 100 institutions and entities participating. So I think this is a reflection of the kind of confidence in the regional response mechanism that exists already in the Caribbean. We coordinate it through our regional coordination center at SEDEMA. And I think that this is where the emphasis has to be placed. We have to work outside of emergencies to build the trust, the partnerships, to make sure that when we are in those emergency events, that the partnerships can work over.
Great. Thank you so much, Ms. Riley, for that. It's really helpful. And thank you all for all of your responses today. We're right up against our time limit for today. I would love to continue the conversation, but fortunately, we do have follow-up calls, as I mentioned, this Wednesday, Friday, and 2 calls the following week. So we can tackle a lot of these remaining questions, I think, on some of those calls. But I really just want to take the time to thank you all again for joining us today and taking the time. And a huge thank you to all of our fantastic speakers today. I think you've brought so many really important insights and technical considerations to this group today. So really thank you for your time and all of the fantastic work that you do. To your points, not just in hurricane season, but all of the time. So thank you for that. If anyone has any questions, please feel free to reach out to the email address on the screen here, and we'll be sharing notes and a recording of this webinar with everyone after the fact as well. As always, please don't hesitate to reach out to any member of the CGI team with follow-up or to be connected to anyone who participated in the call today. So thank you all again, and I'm looking forward to continuing the conversations later this week and next week.